Why Implementation Science Matters, a guide for health researchers. Welcome back to my channel, where we make science practical and impactful. Today, we're diving into a topic that's reshaping healthcare research, implementation science. If you've ever wondered why so many evidence-based interventions don't make it into routine practice, or how you can ensure your research makes a real-world difference, this video is for you. We're going to explore what implementation science is, why it matters, and how you, as a health researcher, can use it to transform healthcare. Why is this so important? Well, no matter how groundbreaking a new treatment or intervention is, if it isn't effectively implemented, it won't benefit patients or improve public health. Implementation science helps ensure that evidence-based practices are not just developed, but also used. So, why does implementation science matter? Let's break it down into 3 key reasons. 1. Closing the gap between research and practice. The average time it takes for research evidence to be integrated into routine practice is shockingly long, sometimes over a decade. Implementation science aims to shorten this time by identifying barriers and developing strategies to overcome them. This means that patients get the benefits of research much sooner. 2. Addressing health disparities. Implementation science is crucial in low-resource settings where health disparities are most prominent. It helps adapt interventions to fit the local context, ensuring that even the most vulnerable populations can access effective healthcare. 3. Sustainability and scalability. It's not just about getting an intervention started, it's about keeping it going. Implementation science focuses on making sure that interventions are sustainable over the long term and scalable across different settings. Now, let's talk about some of the key components of implementation science that you'll need to know as a health researcher. 1. Implementation strategies. These are the specific methods used to promote the adoption of an intervention. For example, training healthcare workers, integrating new technologies, or redesigning clinical workflows are all strategies that can help ensure successful implementation. 2. Implementation outcomes. These are the specific outcomes you'll measure to determine whether an intervention was implemented successfully. Common outcomes include acceptability, adoption, fidelity, and sustainability. Tracking these outcomes helps you understand what's working and what needs to be adjusted. 3. Contextual factors. The context in which you're implementing an intervention matters. This includes everything from organizational culture and leadership support to the characteristics of the population being served. Understanding and adapting to these contextual factors is crucial for successful implementation. So, how can you incorporate implementation science into your research? Here's a quick guide to get you started. 1. Start with a problem. Identify a gap between research evidence and current practice. This could be anything from a proven intervention not being used in clinical care to a public health policy that hasn't been adopted widely. 2. Engage stakeholders. Collaboration is key in implementation science. Engage the stakeholders who will be affected by your intervention. This includes patients, healthcare providers, and policymakers. Their insights will help you design an intervention that's feasible and relevant. 3. Use an implementation framework. Frameworks like the Consolidated Framework for Implementation Research (CFIR) or the RE-AIM framework can guide your research from planning to evaluation. These frameworks help ensure that you're considering all the factors that will impact the success of your intervention. 4. Measure implementation outcomes. Don't just focus on whether the intervention works. Also measure how well it was implemented. This could include tracking how widely the intervention was adopted or whether it was delivered as intended. 5. Plan for sustainability. From the beginning, think about how your intervention can be sustained over the long term. This could involve building local capacity, securing funding, or integrating the intervention into existing systems. To inspire you, let's look at a couple of real-world examples where implementation science has made a big impact. 1. HIV treatment in sub-Saharan Africa. In many parts of sub-Saharan Africa, implementation science has been used to scale up HIV treatment and prevention programs. By identifying barriers to care, such as stigma and access to services, researchers have developed strategies that have dramatically improved treatment uptake and health outcomes. 2. Mental health integration in primary care. In high-income countries, implementation science has been used to integrate mental health services into primary care settings. By training primary care providers to deliver mental health interventions, researchers have increased access to care and improved outcomes for patients with depression and anxiety. As we've seen, implementation science is a vital tool for transforming healthcare. It ensures that the knowledge we generate through research is put to good use, improving patient care and health outcomes on a large scale. Whether you're a researcher, healthcare provider, or policymaker, you have the power to drive real change by incorporating implementation science into your work. Together, we can bridge the gap between evidence and practice and make a lasting impact on the health of our communities. Thanks for joining me today. If you found this video helpful, please give it a thumbs up, subscribe, and hit that notification bell so you don't miss any of our upcoming content. Let's keep pushing the boundaries of what healthcare can achieve together.